Good morning, everyone. Thank you for joining us. My name is Joan Batorf, and I'm delighted to welcome you to this Embrace Aging session this morning. To begin with, I'd like to acknowledge that the land on which we are gathered today here in Kelowna at UBC Okanagan is the traditional unceded territory of the Silcocan Nation and their peoples. I also want to acknowledge that many of you might be joining us from both near and far, and I want to acknowledge the traditional owners past and present of those lands as well. As I mentioned, my name is Joan Batorf. I'm a professor in the School of Nursing at UBC Okanagan and director of the Institute for Healthy Living and Chronic Disease Prevention. We're really delighted to welcome you to the 8th annual Embrace Aging Month. And again, thank you for joining us today. Embrace Aging is co-hosted by 3 partners: the Institute for Healthy Living and Chronic Disease Prevention, Interior Health, and Interior Savings and Credit Union. We launched Embrace Aging 8 years ago with 4 events, and it's increased dramatically over the years. And every year we've organized events to increase awareness about positive aging. And as you will have seen, this year is no different. The sessions are really designed for young and old alike and focus on a variety of topics related to healthy aging and ways to improve quality of life for seniors, for family members, and really for everyone. Our goal is to inspire us all to embrace positive aging. Before I begin to introduce our speakers today, I'd like you to you'll note there is a closed captioning box that might appear at the bottom of your screen. You can move that to any location on your screen as you'd like, just by dragging that box. But you can also turn it off. On the bottom of your screen, there's a live transcript button. If you hover down there, it'll come up. If you can also turn it off if you find it distracting. Anytime during the session, you're welcome to type questions and comments in the chat box, and we will read them out to our speakers at the end. But we invite you to add those anytime during the session. So to begin with, I'm going to introduce and invite Michelle Smith, who's the Regional Practice Lead of Research and Knowledge Translation, Long-Term Care and Seniors Care at IH, to introduce our speakers. Michelle.
Thank you, Joan. I'd like to, it's to be a great presentation today. I'm looking forward to hearing it myself. I'm Michelle Smith from Interior Health, and I'm here with my colleague, Joanne Mcleod, who's a clinical research coordinator and stroke nurse with Interior Health and works along with Daryl Wile, Dr. Daryl Wile. And today's session is Staying Nimble, Healthy Ways to Keep Moving with Aging. And Dr. Daryl Wile, a neurologist, Interior Health, a clinical investigator for Center for Chronic Disease Management and Prevention and Management, UBC Faculty of Medicine, Southern Medical Program, UBC Okanagan, and clinical assistant professor, UBC Department of Medicine, Division of Neurology. So we'll warmly introduce you and look forward to your talk today. And you can put up your presentation if you can, Dr. Wile.
Great, thank you. I hope my slides are now showing. Are they there? Can I get a thumbs up?
Yes, they're showing.
Okay, perfect. So we'll continue. Thank you for inviting me to present today. I'm delighted to talk about this important topic about staying active and keeping healthy through the span of aging. And as was already introduced, this is part of the Embrace Aging event. And we're very fortunate in the interior of BC and in the Okanagan to have a lot of expertise in this area. So I'll highlight some work that's being done by some of my colleagues in that sense. But first, so who am I? Who is this guy, you might wonder? So I'm a neurologist, so I see mostly patients with Parkinson's disease and problems with movement in our clinic, which is in the highlighted box area there, the Walter Anderson building across the street from Kelowna General Hospital. I also work in acute care neurology in the hospital, where I see people with stroke and seizures and other brain and spine and muscle and nerve problems. My research work is done with the UBC Center for Chronic Disease Prevention and Management, So most of the images you'll see used in the presentation are Creative Commons free for reuse images from unsplash.com. Some photographs I've taken, and then this image is from Google Maps. So in a nutshell, what am I going to tell you about? Well, we'll talk about guidelines for exercise and activity in older adults in Canada. I'll talk about some of the evidence that there's benefit for this for the brain and for other aspects of aging. I'll talk about some common challenges that people face when they're trying to stay active with aging, and some unique challenges in the past year in particular. And then I'll touch on some resources and research that you might find interesting or may not have known about in the interior. A caveat, I guess, or disclaimer. So exercise plans are not one size fits all. So everyone needs to make judgments about whether their abilities differ from what's recommended. If you're unsure about it, what you should exercise first is caution, and injury is important to respect us, and we need to avoid overtraining and exercising through injury. And another important point, when we discuss guidelines for activity and exercise, you may not be able to meet all of the targets that are mentioned, but some is better than none in most cases. Why is this important? Well, this is a projection from Statistics Canada about how our population is likely to change demographically over time. This is maybe more true still in the interior in the Okanagan, where we tend to have a slightly higher second peak of our age curve. So we do have a younger adult peak in our population age curve, and then an older peak. And over time, it's expected we'll have more and more people in the golden years, 65 and over. And we need to do our best to keep people independent, functioning, and healthy. So I'll touch now on some guidelines about exercise and activity for older adults, focusing on Statistics Canada and the Canadian Society for Exercise Physiology. So this is the most recent recommendations of the Canadian Society for Exercise Physiology for older adults 65 and over. So to make some highlights here, the recommendation for aerobic activity is 150 minutes a week, and that should be done typically in bouts of 10 minutes or more, and moderate to vigorous intensity physical activity. I'll talk about what that looks like and what that means. There's also advice to include muscle strengthening and bone strengthening activities at least 2 days per week. And in older adults with poor mobility, it's important to enhance activities for balance and fall prevention. So what is aerobic activity? Well, if we think about the guidelines describing moderate and vigorous activity, this may differ from person to person. In general, what means moderate physical activity is that breathing rate increases, breathing becomes a bit harder, heart rate increases, and there will be a little bit of sweat. Vigorous physical activity, typically people will feel out of breath and be sweating a lot. Some examples of moderate aerobic activity would include cycling, working in the yard could meet the mark, mowing the lawn, brisk walking, including when doing activities like golf or hiking, dog walking, or just brisk walking independently or with a partner. These days at appropriate social distance, unless they're household members or in a core bubble. Vigorous activities might also include some of these things done at higher intensity. So cycling, swimming, running, jumping rope. There I have cross-country skiing and other machine-based like elliptical training. But there may be many different examples that you could apply. The important thing here is that both of these things count towards that goal or target of 150 minutes per week. So there's a Canadian program called Participation that's been around for a very long time. And they've issued a couple of years ago a report card for adults. How are we doing in terms of these things, these goals? So for daily movement, I've put there a happy face. Some might put this as a neutral smile emoji. So about 52% of adults that are age 18 to 79 take about 7,500 steps per day or more, which meets that definition for active lifestyle. And a smaller number of people in Canada have a low active lifestyle or a sedentary lifestyle by the mark of daily movement. When we look at the moderate to vigorous aerobic physical activity, it's only about 16% of Canadians that achieve this. And if you look at adults in the 65 to 79 year old age bracket, it's about 15%. This is data from 2019. And we'll touch on a bit later how things may have changed during the last year. What this report indicated with the other indicators for physical activity in Canada is that they need more data. So bone and muscle strength, balance, they did not have good metrics at that point about how many Canadians are achieving the targets that they set. Sedentary behaviors, there's some data, but again, insufficient to reach conclusions that they wanted on this report card. So we'll touch a bit more on this, but when you look at this chart in the bottom of the figure, adults over age 18 and adults age 18 to 64, roughly similar. So the proportion of adults over 65 who are engaging in 4 hours or less of leisure time on screen time, so this is essentially watching TV or YouTube or Netflix or what have you, there's a smaller number of adults over 65 who spend less than 4 hours. So that would mean that more adults over 65 spend 4 hours or more per day watching television and doing other sedentary screen time type behaviors. So Statistics Canada also published some data about how many Canadians in different parts of the country achieve the moderate to vigorous physical activity goal of 150 minutes per week or more. And I found this data very interesting on the Statistics Canada website, and I replotted it to show you something I think is important here, which is that this green line up here is the line representing British Columbians that were surveyed in the Statistics Canada data. So you can see the average for Canada is this red line, somewhere between 35 and 45%. And that number had declined, as most of them did over the period between 2017 and 2018. Most regions in Canada have a lower or roughly average number of Canadians over 65 that meet that mark. In British Columbia, there's a much higher proportion than the rest of Canada of people who meet the target of more than 150 minutes of activity per week. This is reflecting something that I think is really important here, which is that in general, there is more of a culture and lifestyle supporting physical exercise and activity in British Columbia, and that's something we should celebrate. And I'll touch on that more later as well. So I've discussed with you a bit about what moderate and vigorous aerobic exercise might look like. Some other things that are important to consider, especially for older adults who may have balance problems or frailty, include things that enhance balance. So this could include stretching, yoga, Tai Chi, tango dance, boxing is what these icons are supposed to represent. Balancing a pineapple on a stick, I guess on a sunny day would be probably not good for your balance, but it would be impressive. Strength training might include weightlifting, even digging in the garden will build strength. Doing things like calisthenics, so push-ups and curls and sit-ups, and even things like climbing stairs. So those are examples of things that will build strength, that will meet the mark for improving strength over time. Twice a week is the target. So a thumbs down to sedentary time. So avoiding long periods of sitting. Recreational screen time, the recommendation is to keep it 3 hours or less. And when you're standing and doing light physical activity, well, that's great. So we're going to try and practice what we preach here. You may remember Body Break. Body Break is a long-running Canadian program about fitness for Canadians, and two iconic presenters who were also on The Amazing Race Canada and have taken up posting new videos and activities. So I'm gonna now present. Hopefully the sound will play as well. This body break on YouTube, and I want you all to do it. I can't see you all, but I'm going to hold you to it, and I'm going to do it myself as well. So here we have Joanne Mcleod from Body Break, and we're gonna follow along with her. And if you can't hear the audio and you let me know, then I will. I'll try and pass on what she's saying. This is Hal and Joanne saying it's important to stay active, and they're going to show you something that they want you to do. So I'm going to get up and do it. I can't see you, so I'm going to trust that you're all doing it with me. Okay. Okay, so Joanne, I'm going to be leaned over while I'm doing this because my microphone. We're going to start with some shoulder rolls. We don't want to be sitting too long watching this presentation. So now I'm going to do some forward shoulder rolls. She's saying, keep those shoulders moving, loosen them up, try and get rid of some of that tension. And then we're going to start doing these leg raises just to get those leg muscles moving. Okay, that's good. Thanks, Michelle, for being a good sport. This is only about 2 minutes, but it's good even to introduce a couple minutes of activity if you're doing like a long Zoom meeting or something like that. We'll talk later about how there are some activities that you can do that can be done over telehealth or over video format. So we're going to go down the stairs. We're going to go up the stairs. We're going to go down the stairs. Oh, she says, I caught you. We're not going up yet. You got to stay down. Going to do these low steps. Feeling that burn. She's moving the arms a lot more than me. Saying breathe, keep moving. And then pretty soon I think she's going back up. Not yet. Joanne is tough. Okay, so now we're going to widen our stance a bit and do a bit of a knee bend and back up. We're going to bend down, back up. Good stretch in the ankles. Bend down, holding it. Feeling those Achilles tendons and those quads. She's doing this, I should do this. And up. Hands up. Shaking it out. And moving on. Well, I feel energized. There's Hal and Joanne. Okay, so now that we've got that out of the way, hopefully you feel a little bit more loose. Let's talk about the benefits of exercise. So I'll touch on a few things in general health, cardiovascular disease and stroke, and brain health. So I'll just skip through that. So in terms of general health benefits, there are a few things I think are important to highlight. So one of the key things is, I see in the chat, gasp. Oh, you could hear it. Oh, that's good to know. So bone mineral density is improved by weight-bearing exercise. There's a reduced risk of falls and less risk of fracture and injury, which is important to avoid hospitalization, among other things. In terms of flexibility and strength, there's a general age-related decline in muscle strength over time, and that's offset by doing more strength training. And flexibility is good for functional things like being able to do daily activities, getting dressed independently, getting in and out of a vehicle, things like that. They require you to be a bit looser. We know from a result of these and other factors, people have better independence in the long run if they're active. There's lower rates of mortality. And there are numerous things, some of which I'll touch on in a bit more detail, that are improved with respect to brain and mental health. So cognitive function, I'll show you a few interesting studies on this, but executive function, meaning things like planning, sequencing, organizing information, as well as memory function like recall are improved by physical activity. There are known benefits for depressive symptoms and anxiety symptoms. There's evidence that there's improvements in fatigue for people with multiple sclerosis, which is an inflammatory condition of the brain and spine and optic nerve. There are improvements in strength and function demonstrated in people with spinal cord injury. And brain injury from traumatic brain injury or concussion, there are studies demonstrating improved cognitive function. So here's one example of a study from the Journal of Alzheimer's Disease recently, showing that there's improvements in cerebral blood flow, so brain vascular health, or the ability of your body to carry oxygen where it's needed in the brain. So this was a study of about 30 people, average age 66, and these are people who identified having symptoms of cognitive impairment in their middle ages. So they were not people who had a diagnosis of dementia, but people who had symptoms that their cognitive function was slipping. These people were randomly put into groups where one group did stretch training and the other did aerobic exercise. This was a small amount, at least initially, and increased a bit over the course of the study. But initially, people did 30 minutes 3 times a week, and they did those sessions for 1 year's duration. And in that amount of time, with that amount of activity, aerobic exercise, there was a demonstrated improvement in aerobic fitness. So that's this factor here called the VO2 max. So in the stretch group, the pre and post intervention groups scored about the same. The aerobic exercise group, as you might predict, had improvements in this. And there are a number of different cognitive measures. I've highlighted here the logical memory delayed recall, meaning if you're given a list of things to remember and asked later what it was, what the items were. In the stretch group, there was a non-significant increase from 9 to 11 on this test. And in the aerobic exercise group from 9.4 to 13.8, which was statistically an improvement above and beyond what was seen in the stretch training group. There was also a demonstrated increase in cerebral blood flow in a few brain areas, including the hippocampus, which is a structure involved with memory consolidation in the brain, and the anterior cingulate cortex, which is in the frontal lobe, and is shown on these blood flow images, these functional brain images. So here we have a slice of the brain like this, and on here we see the left and the right side. This is a slice of the brain from the front view, and then this last panel on the left is a side view of the brain. And those show roughly where in the brain that increase in blood flow was noted. I'll highlight a piece of work, including one UBC Okanagan faculty member, Dr. Jennifer Davis. This is a systematic review about how cognitive function is affected by exercise in older adults, and that was published about 2 years ago. And this looked at 48 different studies about exercise and its benefits for physical function and cognitive function in older adults. This cool looking rainbow plot is plotting out where the relative impact for physical health and cognitive function was seen in these studies. And the overall conclusion of this was that exercise is good for these things. For cardiovascular disease, we see exercise has benefits for coronary artery disease, the rate of development of that. Blood pressure is improved by aerobic exercise. There's improvements in cholesterol, in risk of diabetes and control of diabetes, including markers like the hemoglobin A1C. And we see lower rates of obesity. Exercise is important for stroke prevention and also for stroke recovery. So moderate aerobic exercise, like we've been talking about, for 30 to 60 minutes per day, most days a week, can reduce stroke risk as much as some medicines we use in stroke. And this is true for stroke of all types, including from plaque in arteries, from small vessels in the brain being blocked, and from a condition called atrial fibrillation. So many people with stroke may be concerned that exercise isn't right for them, but some authors who've looked at this find that this prescription for exercise, if done with appropriate coaching and guidance, can apply to most people with stroke. In fact, for stroke prevention, perhaps around 80% of people can benefit from this. And with the effect of this being so strong for stroke prevention, comparable or better than many of our medical approaches, it must be addressed as an important part of preventing stroke. Just as some background, so In brain diseases like Alzheimer's disease or Parkinson's disease, we see typically a gradual change in symptoms over time, as these are slow progressing neurodegenerative diseases. Many people with neurodegenerative disease also are at risk of stroke or have previous or recurring stroke. And so those are sudden deteriorations in function on top of a progressive, gradually changing illness. So if we can prevent part of the change in function over time by preventing stroke, that will benefit the overall function for people who also have a neurodegenerative disease. As I mentioned before, my area of particular expertise and interest is in Parkinson's disease. Here I've replotted some data from Statistics Canada, the Public Health Agency of Canada. This is now a few years out of date, but it shows you the relative prevalence or the number of people per capita or per standard population ratio in different Canadian regions with Parkinson's disease or related conditions. So the Canadian average number is again shown with this red line. And British Columbia, I've again shown with this kind of forest green line here. And in the Okanagan, the central Okanagan and surrounding areas, I've drawn an Ogopogo here and shrunk it down to make this light green line. So the message of that slide is it's more common here than in many places. Ontario is up here, which has a higher population prevalence, but within BC, the Okanagan is a hotspot. Exercise is good for Parkinson's disease. It probably is preventive of development of Parkinson's disease if people have more aerobic exercise regularly. There's reduced risk of falls in people with Parkinson's when they're active and exercising, and people do better on our functional testing on our neurological exam. Why does this work? How does it work in neurodegenerative disease and Parkinson's disease? Well, it's probably a number of different things, but we know that there's improvements in neurotransmitter function and changes in dopamine release in the brain. There's effects on neurovascular health, so brain vascular health, as I've demonstrated with that other study. Those effects probably are transferable between different groups, not just with mild cognitive impairment, but with other established neurodegenerative disease, for instance. And there's probably effects on brain synapses that are involved with the activities of movement and in areas like where there's increased blood flow. And in addition to that, there's more broad effects on behavior patterns when people exercise. So at multiple different levels, there's probably beneficial changes. I've probably convinced you by now. This is Matt Sekeli down here. He was a graduate student working in the Center for Brain Health when I was a clinical fellow there in Parkinson's disease. And Matt did a really interesting study with Dr. Stossel and the brain imaging group out there that basically showed in Parkinson's disease patients a single bout of exercise, which they did with stationary bike, shows a release in dopamine in the brain that can be measured with brain imaging. So dopamine is a brain chemical that's involved with initiating and selecting among different possible movements. And the release of dopamine and other brain chemicals is involved with that beneficial feeling people get after a bout of vigorous exercise, aerobic exercise, or so-called runner's high. So essentially what this showed was that some of the benefits people with Parkinson's disease feel after exercise probably relate to their brain dopamine being more effectively released after exercise. So if we put that in context, now that we've established, okay, what are the guidelines and does this actually help? What is an active day supposed to look like? This was another layer of recommendations that was put out by the Canadian Society for Exercise Physiology, considering all of these different things. So how do you fit the 150 minutes into a day? Make sure you're not getting too much sedentary activity. And they sort of parse that out into what a day should look like for older adults. And essentially, it's a restatement of what I've told you already, but so you should have that moderate to vigorous physical activity. So that looks like 20 to 30 minutes a day, most days in the week. Muscle strengthening, probably twice a week, and then including activities that challenge balance. And then the other part is including that limitation of sedentary behavior. So sitting for prolonged periods is not good for you. and should be limited to 8 hours, which sounds like a lot. And that could include 3 hours or less of screen time for most people is the advice. And then, like I was saying, breaking up long periods of sitting. So when you're doing physical activities, best to do them when standing whenever possible, including around the house. So thinking about that, so how do we actually do with this? I don't have province per province data on this, but Statistics Canada does have some data on how seniors actually break up their day and spend their time. And I'd be curious to hear feedback if people find this way out of line or if they find it seems about right. Looking at men on the left half of this panel versus women on the right half of this panel, what this social survey found from 2015, published a few years later, was that men in the age range 55 to 64 had about 3.8 or 4, let's say, hours of paid work and did about 2.5 hours of unpaid work around the house. You can probably round that one down. And then over 65, the amount of unpaid work around the house was around the same, and then the paid work reduced. Women generally had more reported times spent on unpaid work around the house, and in that 55 to 64 year age bracket, this probably is averaging out people who work still full-time, people who work part-time, and the people who don't work. So you see a kind of a short number. That if you think someone's working probably 3-4 hours a day, that's probably true for some people, but this probably also includes that average between people who are still working full-time in that age range and people who are not working. And then looking at active pursuits, so this is physical activity, including brisk walking and things like that. We're looking at 2 to 3 hours a day in most of these groups. And then passive leisure activities were slightly more and increased when you transition to that higher age bracket. An important thing with this survey too is that they've listed it in that the internet-based activities or like computer-based activities or technology activities. And I think those were partly included within passive, but also partly within active pursuits, which might skew this a little bit. So the numbers probably aren't quite as good as they look on this graph. Sleep, that sounds wonderful, 9 hours of sleep. I'm not sure that's true for most adults, but the numbers showed it in this survey anyway. So just restating that again, because I think it's important to kind of break this down and restate. So most days, people should be aiming in the older adults group to do 30 minutes of moderate to vigorous physical activity, which could be brisk walking. It's important to take breaks though, and if this is not achievable, then it's good to make a start and do bouts that are 10 minutes or more. Strength training, that could include digging in the garden, going up flights of stairs to work on strength twice a week. And then finding something that's enjoyable, because you're more likely to do it if so, that is good for sharpening balance and flexibility. And then one piece of advice was that there seems to be improvements in the physical function and independence for people up to that threshold of about 7,500 steps per day if people are using a counter or tracker. And then the benefits beyond that seem to level off just for general function and independence. And just as a reminder, again, you got to pick these activities that you enjoy because this is all supposed to be fun. I'm probably making it sound like a lot of work and a lot of tracking and check boxes, but it's supposed to be fun first and foremost. So let's talk now about a couple of challenges in the last section of the talk here, and then we'll have time for questions and answers. So if you imagine a coffee table, in some households, you may have this article on it, probably very few, but this is an article about the climate of physical inactivity in Canada. One of the authors here, Guy Faulkner, is a UBC author. So what this article was about how we increase participation in these kind of exercise activities. And the advice from this is to create a climate for activity, create a social climate. So what does that mean? It means, first of all, making sure people agree and understand and appreciate that it's important to be active in older stages of life. Secondly, improving the environment and the access to resources that allow for easy adherence to physical activity advice. And then policies that encourage activity. So that includes things that encourage activity as part of the daily workplace environment. Those sorts of things create a climate where it's normal and it's thought to be important to maintain activity. When we ask Canadians, well, what are the barriers they see to being active? My takeaway from this, and I'm not sure this applies again equally well to British Columbians who tend to be more active, is that people who are not active to begin with have a harder time getting from inactivity to having it as part of their daily routine. And for many of those people, one of the barriers or obstacles is finding the supports or others to be active with. And so this is where community can be really important in creating that culture of activity. Having someone as a workout buddy or a group, which we'll come back to groups and activity, is really important for motivating people. Motivation is key for maintaining this kind of thing, wherever it's derived from. So if we go back to this and think about how this actually has played out in the last year, so we think about, okay, we got all these pieces of advice and recommendations. Well, then we had the virus come in. And so a lot of these things were then suddenly a lot more difficult to imagine. And there was a lot of recalibration and work to try and navigate around how to apply our usual activities in the context of the coronavirus pandemic. So importantly as well, we know already from data internationally and within Canada that the COVID-19 pandemic has had adverse effect on health behaviors. So there's a lot of commentary in the medical literature about this, why during the pandemic it's important to maintain physical activity for older adults in particular. And the benefits, importantly, might also improve mental health, which is also certainly at risk. There was a Statistics Canada review of general life satisfaction in different age brackets, comparing a time period in June 2020 during the first few months of the pandemic compared with a few years prior. And across the board, people rated lower life satisfaction, somewhat unsurprisingly. And perhaps the effect was a bit larger for younger Canadians, but that doesn't diminish the change in life satisfaction for older Canadians. So if we look at health behaviors within Canada during the COVID-19 pandemic, it's also been shown that there's generally been an increase in people's use of sedentary behaviors to spend their time. So that includes internet time and TV time. People have tended to increase their junk food consumption and also alcohol consumption during the COVID-19 pandemic. This is data from Canadians that was published even about nearly a year ago. So how that shifts over time is important for future outcomes for Canadians' health. When considering what can you do, I would first defer to the BC Centre for Disease Control. I double-checked last night that the recommendations that are there are reflected in today's presentation, but the pandemic is a fluid situation, and there are changes regionally and within certain subpopulations and environments. And I would defer to your local health authority for guidance and the most current advice. But in general, what's currently advised is that indoor physical activity in groups is permissible if it's low intensity. If it's high intensity, then it's prohibited. And so in terms of making that distinction, if you want to make a simple matter of it, high intensity is essentially anything that's going to increase your breathing rates significantly. So high breathing rates tend to have a higher risk in groups indoors of transmission of the coronavirus if someone was to have a risk of transmitting it. And for that reason, currently permissible. Indoor activities include things that are more low intensity, like yoga, Pilates, Tai Chi would fit the mark, exercise machines, and some cardiovascular fitness, stretching, light weightlifting. And then outdoor activities have been, I think, for many people, the mainstay of staying active, including walking with appropriate social distancing, and perhaps outdoor hikes and cycling and things like that might be applicable as well. Team sports are still prohibited, both indoor and outdoor, and there's a phased reintroduction of that in the public health planning. So in the last few minutes before I break for questions, I want to highlight some other important areas of research and resources that are available for British Columbians, and in particular in the interior. So one good resource for this is HealthLink BC. So HealthLink BC actually has physical activity services that will help coordinate with you what activities are available and appropriate. And they're available to do so by email to provide advice about activity. And they have exercise professionals employed by HealthLink BC that will respond to those types of questions. They also have resources on their website that I think are generally quite helpful. I was going to show one of the, I'll just skip back to this. They have something called, I can't recall exactly what it is, but they have a DVD available of exercise videos. And I was gonna play one of them instead of Hal and Joanne, but it's quite outdated, and it's what they refer to as potato quality, or it's you know, like cathode ray tube TV quality, and there's only a few pixels visible. So we had to go with Hal and Joanne. The City of Kelowna has recreation program registration, and they have up-to-date information here about what programs are available for Kelownians, Okanagans. I'm not sure what what it is for surrounding areas, the term. In the past, although this is not currently in operation, there was also a partnership with Interior Health with a physical therapist working in certain City of Kelowna Parks and Rec centers called a liaison or navigator. And that was a person who could make judgments based on health conditions and physical abilities, what programs and services offered by the city were available that were appropriate to that condition. So hopefully that will resume when it's appropriate with respect to the pandemic. In the interim, there is a fairly detailed online guide for recreation and activity. I wanted to highlight as well a program launched at the University of British Columbia, Okanagan, called Small Steps for Big Changes. So Dr. Mary Jung was spearheading this. And this is essentially an evidence-based lifestyle modification program to help people reduce their risk of diabetes and manage their diabetes, incorporating activity. It was a program that partnered with the YMCA of the Okanagan. And among the other potential resources for you, the YMCA website and YouTube has a whole lot of videos that are available for free for home exercise for people that you can view from home or wherever. Dr. Jacoby at UBC Okanagan is a researcher that is active in working on frailty, and hopefully with the recent resumption of human participant-based research at the university that was announced, we'll see more options for studies that people can participate in. There's a UBC program called the Goal Trial that also has some web links for different exercises and videos that can be accessed freely. There's a SCOPE trial as well conducted by UBC. This is based out of the Human Kinetics faculty in UBC Vancouver, but this is a study that is cross Canada. The SCOPE trial is enrolling older adults in a program of physical fitness online and looking at outcomes and supporting people to exercise from home. So this is a way that you could access some resources for physical exercise from home during the pandemic, and also contribute to our understanding of what people need and how to help people in this kind of scenario. The BC Brain Wellness Program was another initiative that was launched by Dr. Cresswell from the Center for Brain Health, one of the other movement disorders neurologists there. And this is actually quite an interesting program that has a variety of bookable sessions and seminars, as well as online exercise classes that's available to people for free. And they have a scheduler on their website, the BC Brain Wellness Program, for you to register for their programs and services. Active Aging Canada is another resource that people can see for accessing online exercise resources and programs. They are affiliated with this other program called Choose to Move. Choose to Move is another COVID-19 home exercise-based resource for Canadians, and basically available through Choose to Move or through Active Aging Canada. So I'm going to stop there. I know I've put a lot of resources there, and we're happy to provide the links for those as well. If you weren't jotting them down furiously, hopefully people are still awake after the mid-session aerobic body break. And at this point, I'll stop and take questions.
Great, thank you so much. That was a great presentation with lots of resources. And we do have some questions already in the chat box. And so for those of you online with additional questions or comments, I encourage you to put them in the chat box. Michelle, do you want to present the first one?
Sure. So why is Parkinson's disease more prevalent in the Okanagan?
Great question. I can answer in a manner that's somewhat speculative. There's probably multiple reasons. So one of them is the age distribution in the Okanagan. Does have a peak of people who are in an older age range, and Parkinson's disease is more common as people age. So just by demographics, one reason is that people on average tend to be a bit older in the area. However, there's also some population level data that show that Parkinson's disease is more prevalent in areas that are agricultural or industrial in terms of their industry. In agriculture, this might relate to groundwater, pesticide burden, and things like that. We know that a number of pesticides can contribute to risk of Parkinson's disease, and some are used in animal models to develop models of Parkinson's disease. So one important correlate to that, or corollary to that, is that it's important to try and advocate for clean, healthy, organic food wherever possible, and reduce the use of some of these harmful pesticides, because I think they probably do contribute to the population level risk of Parkinson's disease.
Great, thank you. I have a question. So you talked about getting the right kind of exercise prescription, and many of our listeners might have, perhaps some cardiac disease, maybe early Parkinson's, maybe early osteoporosis, where they might actually benefit from a prescribed exercise program, as opposed to trying to figure it out themselves or jumping into some resources. And when you go to a fitness center, they have staff there. And then there's somebody called a personal trainer. And then we know that some people are kinesiologists. And then we have some physiotherapists. And they're all kind of in this field, providing exercise advice, I think. So I guess I'm wondering how you sort out who to go to.
Yeah, where do you get good advice? Well, I would say if you're unsure, first of all, about if you have a health condition that bears on your ability to do exercise activities, then it's a good thing to ask your doctor, because they'll be able to provide you with a higher level medical oversight. Is it safe and appropriate for you to do exercise? For most people with chronic conditions, it's probably going to be of net benefit. There are some health conditions where there are risks to certain exercise types. And so if you're unsure about that, that would be a good place to start. With physical therapy, you get a layer of medical knowledge and an application of exercise and rehabilitative approaches that can be somewhat tailored to different medical conditions or different restrictions, and with a focus on and emphasis on safety as well. So a physical therapist is a good resource for people who have a specific limitation or have balance disorders or concerns about falls as a place to start. I think you'll find that most certified exercise physiologists will follow the recommendations of the Canadian Society for Exercise Physiology, and you may get more varied understanding of how those things might apply differently in different health conditions. And so, generally their advice is applied broadly to the healthy, aging Canadian population. And that's why kind of at the start, I list a caveat. If you're not sure if something's safe for you, or you're not sure you can meet the standard recommendations, it's good to start with some of the other approaches. Accessing is another matter. And of course, it's been harder for people to access a lot of health services in the past year as well, in the context of the pandemic. So I can expand on that a bit more if that doesn't quite answer the question, but that's a start.
Yeah, that's helpful. Thank you very much. Michelle.
Barb is asking, how much heavy breathing is too much? How does it affect your heart if your breath is you're breathing too heavily when say going up hills? Sorry.
Right. Yeah. So again, this would be something that might differ depending if you have an established heart condition or a chronic lung disease. But if you have generally good health, then getting your heart rate up and breaking a sweat is of benefit for you. So that might, for some people, going up a hill, depending on the hill, might be moderate aerobic exercise. For others, it might be vigorous. And so finding that point for you where you're getting some exercise, you're breaking a sweat, it might change over time, and the hill might become easier if you do it several times and go from more vigorous to more moderate level of activity. Too much is when you feel you can't continue because you're too short of breath. Or if you feel lightheaded, then you certainly should sit down or take a break. And if you're not sure that you can manage endurance or prolonged activity like that, certainly try to have someone nearby. I guess at this point, a socially distanced partner, or if it's someone you're walking with who shares a household with you, they can be by your side as well, I guess. But it's important to be safe.
Yeah, good advice. There's a comment from Diane. I've participated in HTO hip and knee class pre and post surgery. Way more uptake on Zoom than doing this in person during and not during COVID. So it looks like the Zoom has been a huge success. More accessible for older adults, and accountability with an invite, ongoing reassessment, and significant other can join the video as well. Great general stretch, strength, and balance program with options depending on abilities. Great program, great data. Hope it continues virtually, as way more uptake and improvements make for better surgical outcomes. More collaboration with community programs and medical personnel would be great, not as a one-size-fits-all approach. So good point about specialized programs and perhaps continuing with Zoom programming far into the future. What do you think about that, Dr. Wile?
Yeah, I completely agree. We've seen a lot of similar comments in different conditions or disease groups where a lot of people now have better access than they had previously to resources like this. And there might be less of a barrier to getting on Zoom and doing something than to have to go and meet new people and drive somewhere and find parking, et cetera, and take a gym bag or what have you. So for a lot of people, it actually creates an opportunity that wasn't there before. For others, there's intangible benefits to doing things in person in a group that you can't meet on a Zoom meeting. And I think for most people, there's some of both. So there might be situations or activity types that are well suited for you to a virtual kind of delivery format. And then it might also be good to pepper in some other things. So maybe some walking outside or distance walk with a friend. And then hopefully in the near future, we'll be back to more outdoor group exercise activities and things like that.
Great, great, thank you. Michelle, do you have a question?
I can respond for Barbara was saying, okay, thank you. You've been very interesting. And I was wondering too with the breathing, because some people talk also about how much pain is an acceptable level of pain when you're starting to do any kind of exercising. Like when is there a way you can tell when you're pushing your body too hard versus working towards it?
That would depend on what the cause of pain is. If it's related to a specific problem like a low back pain and a herniated disc in your lumbar spine pressing a nerve or something, then there might be advice from physical therapists or rehab medicine experts as to what kinds of activity would be likely to help rather than worsen that. Similarly, if it's bone and joint related pain, then it's good to consult an exercise professional or physical therapist. Similarly with things like muscle tendon sprains. And some of those things, rest is actually the prescription until it's recovered. So that's a good example of where it'd be good to get some advice on how to tailor or modify.
Mm-hmm. It's great, thank you. This has been really great. I see that we don't have any more questions or comments, but I do want to thank you, Dr. Wile, for alerting people to some of the ongoing research that's happening both at UBC Okanagan and UBC Vancouver related to exercise. And obviously there's an opportunity for people to join those studies if they're interested. We also list some ongoing studies on the Institute for Healthy Living and Chronic Disease Prevention website as well, where some of our faculty, research faculty and students are recruiting participants. So if people out there are interested in getting involved in some of the research, there's certainly lots of opportunity to do that on both campuses, really, and right here in BC. So I'm wondering, as we're nearing the end, if you have any closing words of advice for us.
Yeah, well, thank you as well for listing other resources. It's kind of like one of those speeches where people are trying to think of everyone they need to mention. And there's such a breadth of expertise and so many people working in this area. It's a real strength in the research that's being done at UBC Okanagan in the field of behavior change and exercise and living in an active lifestyle. Probably that reflects that green line above most of Canada. We tend to be a more active population, which I think for most people, it's a pat on the back. So keep it up and try and exercise for your mental health as well during the pandemic. I think it's super important.
Great advice, especially as we're heading in to hopefully the final stages and have to stay the distance yet a little bit longer. So thank you once again, Dr. Wile, for joining us today, and Michelle for helping us organize this session, and Marie for jumping in case there were some hard questions. And thank you everyone for joining us. And I hope you might have a chance to join one of our future events. I understand we have about 10 events left in Embrace Aging, so still lots of opportunity for you to jump into a session. And you'll find those events on the Embrace Aging website. So thanks once again for joining us, and stay active. Thank you. Bye-bye.